So thank you so much for having me. I really appreciate your time and coming out, and thank you. Do you have some questions?
Well, I was going to say that in the spring, when the snow melts, there's mold.
Mm-hmm.
Snow mold. They call it snow mold.
Mm-hmm.
And you know, I have dogs and I groom dogs, and they bring in a lot of that stuff on their coats, and I just have one heck of a reaction with that. Because I tested positive. I did allergy tests, and I tested positive for molds and old. They call it old dust,
Mm-hmm.
like dust that you get when you go into like a library or a coliseum or, you know, something like that. I react more to that than I do to anything else.
Yeah, so patients who have mold allergies and mold sensitivities, and especially too with the snow melting and everything starts to melt out, a lot of people have problems with mold even during the winter time, because all of our windows and doors are shut up. And so all of those mold spores are microscopic, can be activated in the winter time. The low dose immunotherapy that we do, we have an inhalant mix that has and incorporates a lot of the molds and the danders and so forth, that is very helpful for allergic patients with mold. But if there's patients that are just reactant to some of those molds, increasing your binders during that time period. So when you're grooming your pets and they're bringing in some of that mold and so forth, making sure that you're taking some binders, you know, before and afterwards would be really helpful to reduce the effects of the mold on the body. Yes?
I was diagnosed with Lyme and was treated by antibiotics and so forth a couple months ago, and I started getting a strong sense of depression and anxiety, and then I saw my primary doctor, and he prescribed first Zoloft and then Paxil. Both of them took me on a very bad trip.
Mm-hmm.
Does that tie into this, or?
It does. Yeah, there's a lot of patients who are treated with antibiotics, and then, you know, they go in through, and it's because the Lyme was probably there for a longer period of time, and it's already gotten into the brain, so it affects our neurotransmitters production. And so oftentimes SSRIs, you know, like Paxil or Zoloft and things like that, can be very helpful, but sometimes they're not. And it has to do with your genetics. It has to do with how your neurotransmitters are. And, you know, there are a lot of natural things that you can do to increase serotonin levels and dopamine. And a lot of Annie Hopper's brain retraining does that, as well as, you know, diaphragmatic breath work and looking at, too, maybe other toxins that still can be contributing to that brain inflammation is really important, and maybe even changing up some of your diet and your foods that you're taking in. So I would look at some of those areas to be able to help. Mm-hmm, you're welcome. Low-dose naltrexone, yes. So there's several different anti-inflammatories that I really like for the body. So low-dose naltrexone is really helpful for decreasing antibodies, in particularly with autoimmune disease, and also for pain. So low-dose naltrexone is fabulous for that. That can be something that can be compounded. At a compounding pharmacy, I find it best with most of my patients to have it compounded. Or if they can't afford to do the compounding, you can get a 50 milligram tablet of naltrexone, and you can crush it and add 50 milliliters of sterile water or distilled water, and start by taking a milliliter at night and gradually working up. Usually 3 milliliters are what women do best at, and 5 milliliters at night before you go to bed for men. But yes, I love low-dose naltrexone. Two other things that I really like too is palmitoyl ethanolamide, for short. That's PEA. And there's a company called Vitalis that makes PEA. And there's so many great studies about this supplement that's very helpful for pain. It helps with the neurological system of the brain. It even helps with the eyes to regenerate glaucoma. And it's just been amazing to add to my practice, and have found a lot of patients find good relief from that. Definitely. Thank you for mentioning that.
Is that relieving the depression or just anti-inflammatory in general?
It's mainly for an anti-inflammatory, but it also can help too to reduce antibodies anywhere in the body, and it also helps with decreasing digestive disorders too. Yeah, so it's multi-purpose, yeah.
Would that help with like cytokine storms then?
You know, that's a great question. I would think so because it's an anti-inflammatory. When I think of a cytokine storm or a Herxheimer reaction, I think binders. I want those binders to grab hold of, you know, those exotoxins and get them excreted out of the body. Yeah, where PEA, the palmitoyl ethanolamide, is mainly for decreasing inflammation and helping with regeneration of the brain and decreasing pain, and particularly the joints as well, and muscle pain that comes with Lyme. Yes?
Is that through a pharmacy or is that a health food store?
It's actually, you can order it on Amazon. Yep, the name of the company is Vitalis,
Okay.
and the name of the product is PEA. So if you Google that, it'll come up.
PEA will come up. I won't get toilet paper.
No, if you put in, put in PEA supplement, and it'll come up palmitoyl ethanolamide. Don't ask me to spell it.
I do that low-dose naltrexone, and I get it compounded from, I remember is it Newbridge, or?
Yep.
Where's the other one around here?
Merwin's. So Newbridge's turned into Merwin's.
Okay, Merwin's, yeah.
And then there's also Bloomington Compounding Pharmacy.
And for a 3-month supply, taking one in the morning and one at night, it's $159, and my insurance covers it.
That's great to know. Yeah, so
My insurance covers it.
so she's saying that she gets the low-dose naltrexone covered by her insurance even when it's compounded. So, and that's $159 you said for a 2-month supply?
3-month supply.
3-month supply. Fantastic.
So, I mean, that's like $50 a month.
Mm-hmm.
And so, you know, it really helps.
Mm-hmm. Definitely.
And that helps with depression?
The low-dose naltrexone, any which way by we can decrease inflammation, I think helps depression, you know. So any way that you can get that through exercise, through the breath work, through the diet, you want to look for the underlying causes of that. So decreasing that inflammation will definitely help. Pardon? Yes, definitely. Yep, to definitely boost the immune system by decreasing those antibody levels in the body too, and regulating the immune system function.
But there is a caution to that I have a friend that's an anesthesiologist, and she said that if you have anesthesia or if you have major surgery and they give you pain meds, they won't react. Your body will not, you know, if you take, you know, like, what is it? What is the big one now, the Oxycontin?
Yes.
If you take those, they don't work because
Right.
naltrexone blocks their working.
Right, so I want to make sure everybody heard this because that's very true. So if you were going to have a surgery or you're going to go on to some sort of narcotic pain medication, taking low-dose naltrexone with pain medication doesn't mix. They will repel each other. They don't mix well together. But the PEA, that one actually helps to work synergistically with any kind of narcotic or pain medication. So there isn't a contraindication with the PEA. Heavy metals.
I was tested for high doses of mercury, lead, cadmium.
Mm-hmm.
And, you know, I didn't mix things from the internet because they say if you're killing Borrelia, the Borrelia actually hang on to the mercury, so you're killing it.
Mm-hmm.
It's releasing mercury. So it's just kind of a catch-22 here. You're trying to, really, you know, remove mercury from your body, but that disturbs the Lyme. Then if you kill the Lyme, it cranks up the mercury in your body.
Right.
You ever had to deal with that?
Yes, definitely. So heavy metals are very common in Lyme disease. And you know, there's multiple sources that we're getting the mercury from the foods, from the larger fish like swordfish and salmon. They're coming from the amalgam fillings in our mouths, you know, and in the environment itself. So aluminum is rampant in our environment as well. That's another major problem. But cadmium, arsenic, all of those things it's being found in the water systems. It's being found in our food supply. So filtering, making sure you have a really good filter for your water and not drinking tap water. And the two that I typically will recommend is a reverse osmosis system, or just going to the grocery store and filling up, you know, a good 5-gallon jug of reverse, you know, osmosis water. When that takes everything out of the water. But I don't think it tastes very good because all the minerals are taken out of it too, and you need those minerals. So you can add in some fulvic or humic acid, which are natural minerals that also has some chelating properties to them. And also you could add concentrace, which is a trace mineral supplement to the water. The other type of water filter that I really like is the Big Berkey, and it's just a countertop device that you can put on your counter and you pour the tap water in there, and it has a filtration system inside of that that really helps to pull out a lot of those heavy metals and pharmaceuticals and everything else that are the pesticides that are all in our water. But heavy metals are a major issue. I often see, I like being able, in treating Lyme, number one, I want patients to help increase their immune system. So I want their immune system to be functioning really well. I don't often treat patients that come in right away with any kind of antimicrobials until their immune system and they have the energy in their body to be able to fight this off. And so starting with the immune system, getting that regulated, getting some energy levels into their body, and then being able to go after some of the larger macroorganisms in the body. Those larger macroorganisms are parasites. Parasites are known to inhabit and contain nematodes, which contain, you know, nematodes contain Lyme. And inside these parasites are Lyme bacteria, yeast bacteria, and heavy metals. And so those parasites will excrete these exotoxins and endotoxins and cause the body to become inflammatory as well. That slimy biofilm layer, that hides a lot of heavy metals as well, and there's heavy metals in that biofilm layer. So doing some cyst busters and biofilm busters are really helpful to be able to get some of those biofilms to release some of those metals in the body. But you've got to have those binders to grab hold of those and get them out of the body. So that's why binders are so important with Lyme. It's not just to bind up, you know, exogenous toxins, but also the heavy metals and then the cytokines that are released in the body with Herxheimer reactions. Mm-hmm.
Mm-hmm. It's like every time I do it, I just keep herxing because I think it's like, but if I don't, I feel kind of good. Mm-hmm. And so then I think my thing that I haven't been doing is taking binders with that.
Yeah.
So I just kind of lay there and like,
Yep, so any kind of cytokine storm, any kind of Herxheimer reaction, you know, make sure you're taking a binder with it. And, you know, he was talking about taking stevia, you know, which is wonderful for Lyme. Yeah, the Nutramatic stevia was in a published white paper talking about the ability for it to have antimicrobial activity for Lyme and breaking up some of those biofilms. So I'll have patients make and put together like a lemonade. So you just take some filtered water, you put a little bit of fresh squeezed lemon juice at the bottom, and then put a dropper full of stevia in there. For starting out though, you want to take even just a drop, and you can dilute that drop into a glass of water and only drink half of it, so you're doing half a drop.
I drank half of one of these and I didn't realize how much stevia was in there. It smelled like really bad on that.
Yes, definitely. It's a good thing, you know, I mean, it's showing that you've got some biofilms, it's breaking some of those up, and it's releasing some of these toxins. So getting a binder is going to be helpful to get those toxins out of the body. You break them up and bind them up and get them out.
Is that why I always get sick after I eat? If I don't use, you know, sugar or anything in my tea, if I put stevia in my tea?
Yes.
Is that why I get sick? I thought I was just allergic to as another artificial sweetener.
No, You're getting, the stevia that you're putting in the tea is causing that biofilm to be, you know, broken down, and you're releasing some inflammation in the body.
I should be using stevia.
You can, but just start with smaller amounts.
Yeah.
Mm-hmm. You had a question?
Just if you didn't catch everything she said, we'll have the taping up on our website in a few weeks if you missed.
Thank you for coming.
Thanks.
Yes?
What do you like to use for parasites?
So I have a list of things that I love for parasites. I really like Mimosa pudica. It sounds like some fancy alcoholic drink, but it's not. Mimosa, M-I-M-O-S-A. Pudica is P-U-D-I-C-A. And it's a shrub that is very powerful for releasing parasites. I also like neem, N-E-E-M. And those are the two that I really like that you can do on a regular basis. With parasites, you really have to be persistent and consistent. And taking them twice a day is really helpful. So starting with whatever the directions on the bottle say, you know, for the mimosa or for the tincture of neem, starting at really low doses, okay, and gradually working up. So taking a dose in the morning, taking a dose in the evening, and then taking a binder about a half hour later, okay? Because they're gonna get stirred up, you're gonna start to feel some rumbling in the tummy, and those guys are getting awakened, you know, from these products that are helping to release those. For some patients, they get good coverage for anti-parasitic medications, so we'll prescribe some anti-parasitics, you know, for them. But I really like, Des Bio makes a tincture that has a combination of herbs in it, like black walnut and wormwood and clove. For those, I would pulse. And so I would have the patient take it for 10 days and then be off for a week and then pulse it again for another 10 days, just to kind of get that ebb and flow with how the parasites grow and develop and their babies and getting after them and treating them for a long period of time. You know, if you've never done a parasite cleanse, they're wonderful to do, especially with the change of seasons in the spring and in the fall. And initially, when you're starting to do a parasite cleanse, sometimes what happens is they're releasing a lot of these cytokines and toxins into the bloodstream. And so I've had some patients that end up with tachycardia, and because their blood becomes very viscous and thick. And so taking some sort of systemic enzyme is important, you know, so doing a binder to bind up those toxins, but then also being able to take some sort of systemic enzyme like nattokinase, streptokinase, you know, lumbokinase. All of those are really good systemic enzymes that you would take away from food. So it's working, it's kind of like digestive enzymes, right? You got your amylase and the lipase and so forth that are helping to break down the food. These are systemic enzymes that help to break down, to make the blood not so thick and congested, especially when you start killing off parasites. So that's a great question.
Just a point on parasites, I'm kind of dumb on this, but do we all have parasites in this? Is that what you're saying?
Yep, if you have a pulse, you have a parasite. So they're very common. And most people think of parasites, oh, that's a third world issue, but it's really not. It is very real here in America. And unfortunately, there are tests that you can do, but we don't really have a whole lot of really good parasitologists. I had one patient that, that came to me and had actually sent their stool over to Africa, because in Africa they have wonderful parasitologists there because that's all they do. They look at those day in and day out. Here in America, our OMPs that you can get, the ovum and parasites at your regular standard, you know, Western medicine doctor's office, they're gonna not catch a lot of those parasites that are in the stool. The other aspect of parasites, that why they're so difficult to catch too, is the fact that when the parasites get excreted from the body, from its host, there's this autophagia that takes place that causes, they have an enzyme that is able to degrade that and pull them apart so that they're not even, like they never existed. And so there's a particular enzyme that can break them down in that manner. Yes?
What parasites are you speaking of?
Nematodes, trematodes, strongylides. There are multiple different parasites.
Oh, really?
Yes. Mm-hmm.
See, all kinds of things living on me.
Definitely. So it is a big issue, and I noticed that if I can get the parasites out of the body, those encase heavy metals, and they encase hormones, and they encase Lyme. So getting those out of the body. So a lot of patients who have Lyme, if they've been treated with antimicrobials, antibiotics, any kind of herbs, or homeopathy, but yet they're still having problems, is probably because they didn't have parasites addressed. Yes?
You've heard Alan McDonald's talk about how they found nematoid worms in these people's brains that were donated. inside those worms were the Lyme spider. You've heard about that. I know you have.
Yes.
So, I mean, we're just walking, whatever you want to call it.
Right. Yep, definitely. Yeah, it's a big issue. And in particularly too, I mean, look at how many young people these days in their 50s are developing Alzheimer's. You know, there's a practitioner that I work with, her name is Carolyn Bowles, that she's at our office, and she has been trained in the Bredesen protocol for Alzheimer's and brain infections and so forth. And so it's a very real issue. Mold and parasites and Lyme, all of these things, there's so much overlapping with all of these. And so you've got to address the heavy metals, you got to address the toxins, you got to address all of these things. And people are ready at different times, you know, and, you know, I wouldn't go after heavy metals as somebody just coming in at the clinic, you know, at the first off. I remember I talked about just increasing their immunity, increasing their immune system's ability, and getting enough energy in their bodies, like using L-carnitine to be able to get more energy in their body, or maybe they're, you know, the methylmalonic acid is low and they need more B12, you know, so there's so many different things that that the body needs that energy to be able to fight off. And oftentimes you increase somebody's immunity, you get their microbiome and their digestion working, they feel 50 to 70% better. Yes?
What are your thoughts on the M-Wave 2 or like Alpha Stem?
I love the Alpha Stem. So the Alpha Stem is basically these electrodes that you hook up into your earlobes, and the Alpha Stem device also has some pads that you can also put on for pain. So it helps with pain, and it basically helps to meditate for you. You know, some patients find it really difficult to even get into that meditative state because they're in that fight or flight so much. And so this Alpha Stim is fabulous for pain, and is fabulous for meditation and just getting your body into that alpha state to be able to relax. Mm-hmm. We do. We do. Yes, definitely. So at Newbridge Clinic in Edina, we have, and also another modality too that we have that we like to have patients try is when they're herxing a lot, it's oftentimes those heavy metals that are stirred up, it's the biotoxins from yeast and so forth. So doing foot baths, ionic foot baths are very helpful. We have that in our office. We also have an Alpha Stim. And so a lot of my patients that come in, I'll just, you know, during the visit, I'll have them put that device on and see how that affects. It's really helpful for anxiety, for depression, and is a wonderful adjunct for pain control. Yes?
Can I ask you about the Alpha Stim? This is probably really naive, but is that not electrical, I mean, is that not dirty electricity or EMF or anything? Is that not a negative?
You know, that's a great question. And
but I got scared to use it when I started hearing about all the EMFs because I don't understand how all of that works. So I just didn't know if you knew.
Right, definitely. So that's a really good question. And, you know, with any kind of device that you have that you plug in or that's battery operated, it's going to have some sort of electroconductivity with it. If you're super sensitive and so forth with EMF exposure, I mean, the only thing is we don't know how your body's going to respond. So just trying it and seeing how your body responds. I have some patients who are so sensitive they can't use those devices like that. So utilizing the diaphragmatic breathing. And the other thing that's super powerful too is tapping. And you know, they have so many free resources online now with these summits, these health summits that they have. So there's been a parasite summit, there's a tapping summit that's coming up. So if you just Google, you know, Lyme summit, Dr. Jay Davidson has done several Lyme summits. All of these things are just great, valuable, free information that you can learn about. But that's a great question. I think that if you have it, try it and just see how your body responds to it. For the most part, I find patients respond really well, and it's very powerful.
Okay. I've heard great things, and I mean, I did use it a little bit. I'm more referring to my girls using it, but I wasn't sure how that all, you know, which to do.
You know, and a good thing to do too may be for you to call the company and talk to them and share your concerns with them and see if they've done any studies or reports about how much EMFs are related to that. So I would go ahead and give them a call. Yeah. You're welcome. Did you have another question? No? Okay. Well, thank you so much. I so appreciate your time tonight, and I definitely would be back to come and speak again. And I appreciate you all and your support with one another. And if you have any other questions that you want to ask, I'll be around afterwards as well, okay? Thank you.